Paul Dendale. I'm Secretary of the European Association on Cardiovascular Prevention and Rehabilitation, and I'm interviewing today Professor Stephan Gielen, who is the President of the Association. Stephan, as you know, preventive cardiology is becoming more and more important to stem the tide of heart disease in our countries. And the association is organizing the biggest symposium on preventive cardiology called EuroPrevent. Could you tell us what we can expect from next year's symposium?
Well, before going to next year, perhaps let me just summarize where we are right now and what we talked about at EuroPrevent 2012 in Dublin, because this was a very important meeting for our society. It was the rollout of the new 5th Joint Task Force guidelines on cardiovascular prevention. So it was an important step forward to coordinating and better harmonizing preventive efforts across Europe and beyond. And this is the first step really into getting down the burden of heart disease in Europe and other countries. And we are already receiving a lot of attention to this new guideline project. And we are in the process of rolling out new educational tools like the Heartbox tool to allow general practitioners and cardiologists to better monitor their patients for heart disease risk. And next year, EuroPrevent will have a different focus. It will be the universal approach to prevention. Now, what does universal approach imply? First of all, it implies that it is not a single speciality that is concerned with preventive cardiology, but it is the general practitioners, it is the cardiologists, the internists, it's nutritional experts, physiotherapists, etc. So all these professionals are welcome to come to Rome and to join us in our efforts to really get an interdisciplinary approach to cardiovascular prevention and rehabilitation. And the second implication of this title, the universal approach to prevention, is that we are not just looking at Europe, but we are going beyond. We are reaching out to other countries in the world, to the Americas, to Asia Pacific, to South America, and we invite the national societies from those countries to present their experience with prevention under very different socioeconomic circumstances. And the third implication of universal approach is that it is not just lifestyle and exercise, but it's also medication. It's the understanding of the basic mechanisms of disease development. And this also means that we are reaching out to working groups that have a strong hold in preventive medicine within the ESC, like the working group on thrombosis, on vascular biology, on peripheral artery disease, and on hypertension. And all these working groups will have a chance to organize their own track of sessions within EuroPrevent Rome, and they will help to expand the scope of the Congress beyond what we used to see in the past. And we are very happy to welcome them to EuroPrevent.
Okay, and apart from EuroPrevent, the association has several other educational tools, courses, etc. Can you elaborate on this?
Well, we do have other educational approaches, and one of them is, of course, the masterclass, which is organized in conjunction with EuroPrevent. There was a focus on hypertension at EuroPrevent Dublin, but now in Italy we have a very strong sports cardiology group, and the Italians are the forerunners in screening professional athletes to exclude them from the risk of suffering sudden cardiac death. And therefore the masterclass at Rome will be focused on sports cardiology and screening athletes to prevent sudden cardiac death in professional and in amateur sports. And you are more than welcome to join this very important symposium, which is really on a top level. It's organized in association both with the National Olympic Committee of Italy and with other professional sports bodies both on the European and on the national level. Another important educational tool that we offer is the Burn course on cardiac rehabilitation and prevention. And this course has been organized for the last years by Hugo Sana and Jean-Paul Schmidt at the Inselspital Bern. And they offer both a basic and an advanced course. So when you start a rehabilitation program, the basic course will give you within 3 days the understanding what is important, what are the core content features of rehabilitation, and how do you set up the course in first place. And the second half of the course, the advanced one, gives you a better understanding of the pharmaceutical and lifestyle changes that you want to implement, how to audit and monitor rehabilitation programs, and also how to do research in cardiovascular rehabilitation. So it's a very well attended course. And for more than 3 years in a row, we have also been offering the Research Methods Training course, which gives young scientists and clinicians the tools to develop and to start a research program of their own. It's a course from the very beginning, the first idea for a research topic, over the project development, how to write a study protocol, how to analyze the data that you acquire, and finally how to publish a manuscript and put together all your data so that you are well represented in the scientific world. And this is another important course. And more courses, I'm sure, are going to run out because also our sections are very active in the area and will offer specialized courses over the next year.
Okay, and this year the ESCL platform, the e-learning platform from the ESC has been launched or will be launched. What is in it from the point from the association? What can we expect from the e-learning part?
Well, the e-learning platform is a huge step forward. It's like turning the old book education into the 21st century. It's a universal tool in the first place, which offers both educational content like recorded seminars or excerpts from EuroPrevent lectures to be displayed online and to be accessed 365 days, not only during the Congress. So you have a prolonged access to scientific content. Then you have structured multiple choice questions to assess your learning objectives, whether you really understood what has been presented in the lectures and courses. And third, the e-learning platform will have a very close interaction and link with our textbook series that is currently under production. Next year we will roll out the first volume of our textbook on preventive cardiology, which will be dedicated to the clinical implementation of cardiovascular prevention. So it will be a very practical hands-on textbook telling you which core components of preventive cardiology you can implement in which clinical setting. And the next textbook to be published in 2014 will be on sports cardiology. And the third volume will address the integrative biology of cardiovascular prevention to give those who are interested in translational sciences or basic sciences an understanding where there is still a need of research and what is already known about how we can prevent cardiovascular diseases. Because I believe that understanding the pathophysiology of the disease is always the first and most important step in developing effective preventive measures.
Okay, so everything you always wanted to know about prevention, rehabilitation will be available on the web or in the books. There is also a cardiovascular disease prevention toolbox containing the heart score, containing the guideline learning tool. Who is it for?
Well, this toolbox is for takeaway here at the ESC Congress and of course at EuroPrevent, and it offers the basic tools that you would need to do a quick assessment of the cardiovascular risk in your patient. It's not just for cardiologists, but it's also for the general practitioners and for internists who see patients at a high cardiovascular risk. And everyone who is treating hypertensive patients, diabetic patients, or patients that are overweight or obese, all these professionals need the toolbox in order to better estimate the cardiovascular event risk in their patients. And from that point, they can start the appropriate countermeasures. And a lot of publications have come out in the recent years clearly showing that preventive cardiology is the most effective measure against myocardial infarction and heart attacks. It's much more effective than interventional cardiology. However, it is still under-recognized in the clinical practice. And this is our goal, to promote the awareness for implementing prevention in everyday life. And we cordially invite you all to join us in the effort, because it's worthwhile, and you really save much more lives than by just transferring patients to revascularization procedure. That is treating or repairing the patient after the accident occurred. And we are trying to prevent the accident in the first place.
Okay, and in the beginning you spoke about this important reaching out to other societies, other people. Who is the aim for this reach out program? Who would you like to join in this effort?
Well, reaching out to new partners is something that has always been on our agenda. As you know, the ESC now comprises 54 member countries and affiliated societies. So a very large proportion of the world is already attached and affiliated to the ESC. So within ESC, we really have to reach out to those countries that have the highest burden of cardiovascular disease. Many of them are in the former Eastern countries, and countries like Russia or Ukraine or Bulgaria, they are all having very high casualty figures with regard to heart disease. So they have already approached us to help them in organizing educational programs for their local physicians, many of those programs to be rolled out in the native language in order to implement the ESC guidelines for prevention in their countries. And at the same time, we are also living in a global village, so to say, which means that there is a need to form global alliances for cardiovascular prevention in order to have a professional representation of scientific knowledge and clinical expertise when dealing with partners in politics and with the WHO, for example, and WHF. And we are in the process of talks with various national societies what is the best way of forming such a global alliance. And we hope to move forward with that by having direct talks to the partners at EuroPrevent Rome.
Okay, so you are presiding over a very active association.
Yes, exactly.
And I hope that many more people will be interested in preventive cardiology and will come and join the association. Thank you for the interview.
Thank you very much, and we need everyone who is helping our cause. Thank you.